Good morning, and thank you for coming along for what is a very good day. I've been joined by Professor Ben Cowie, who is heading the Victorian Government's Vaccination rollout program, and I've also been joined by Janine Trevelyan, who heads up the whole COVID and vaccination program out here at the Austin. There's a few things to get through, so bear with us. So there are 25 active cases of coronavirus in Victoria today. That's 0 locally acquired or hotel quarantine cases in the past 24 hours. Some 8,277 cases, results came in yesterday, all negative. There is still 1 case in hospital out of those 25, and we wish that person a speedy recovery. Just for the record, the department is just seeing out 2 indeterminate results for 2 hotel quarantine workers that came in over the last 24 hours, one at the Novotel and another at the Pullman. These initial indeterminate results through saliva testing were then followed up with PCR results, and out of an abundance of caution, some intermediary measures were taken place around each of those places of work and immediate contacts until such time as those PCR tests were then followed up. And the good news is that those 2 PCR tests were well and truly negative, and those public health responses have subsequently been turned down. That just goes to show the very risk-averse nature of the manner in which those daily testing results of all CQV staff are dealt with, really risk-averse, minimising any possibility of transmission exposures. We are currently managing and monitoring and testing the remaining primary close contacts associated with the Holiday Inn cluster. For a 3rd straight day, the number of new contacts notified the department within the 48-hour benchmark met the 100% mark, and that now runs over the course of the last week at 99.9% for that period of time. I'm pleased to say there were no further exposure sites listed, and of our current exposure sites, we're advised that some 546 people associated with the Terminal 4 Melbourne Airport's exposure site have been reclassified, and we thank those people for the isolation and the support that they made sure that not only were they keeping themselves safe, they were keeping their families and all Victorians safe. We're continuing to work through the remainder of that Terminal 4 large group of people over the next few days. And we're also now well and truly into a whole range of Day 11 and indeed Day 14 tests for those clusters. 11 of the 25 people associated with the Brunetti's workplace site have tested negative on their Day 11 tests, and we're expecting the further results for those Day 11 tests today. All the primary close contacts associated with the Glenroy exposure site at the Kinder have tested negative on their Day 11 results. The nearby Early Learning Centre in Glenroy start their Day 11 tests tomorrow, and the Day 11 tests, including the large number of students from St Aloysius Primary School in Ballarat for the Queen Victoria Markets exposure site, commenced today. And all of the people associated with the Sydney Road private gathering, all of their Day 11 tests have come back, and they are all negative. Given the number of cases linked to that site, we are ensuring that their Day 14 tests are part of their quarantining processes, given the wildly infectious nature of the UK variant. And of course, all 17 of that group came back negative. In regard to testing, our testing numbers were stable for this weekend, with no sites reporting waiting of more than 30 minutes. We've now got 14 sites operating extended hours, and those hours will continue to be maintained and reviewed subject to ongoing demand. Our rapid response testing teams are now being redeployed to the large number of people who are seeking testing in those day 11, day 14 testing arrangements for quarantine and isolation in their private residences. But today is really a good day. Today is about the first day in the comeback to the end of this global pandemic's ravaging of our nation and our community. Today, the Commonwealth-led COVID vaccine program has commenced in Victoria. It started earlier this morning in hospitals just like this one and in settings just like this. And for people like Grace and Chris, Grace, a frontline healthcare worker here at the COVID screening clinic at the Austin, and Chris, a mental health worker at the CQV hotel system. They are the real heroes of the past 12 months, and it's only appropriate that those people who have put the most on the line get first in line when it comes to the vaccine program. And it was a really exciting moment for them and their colleagues to start this process here at the Austin.